Hospitals and health systems are cornerstones of stability in their communities, contributing $6.2 billion in community health benefits last year. This week, we're looking at how Ely-Bloomenson Community Hospital is investing in health and well-being. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm Abby Mochtig. In this episode, the MHA's Tim Nelson talks with Jodi Martin, the marketing and communications team leader at Ely-Bloomenson Community Hospital, about their community benefit efforts. From free flu shots and blood pressure tests to student scholarships and healthcare summer camps, these initiatives extend care beyond hospital walls.
So there's been some high-profile attention to sort of larger systems and their community benefit efforts, but smaller systems and smaller hospitals aren't neglecting this either. They're doing this kind of work too. What does that look like up in Ely?
Well, for us up in Ely, we try to do a variety of things throughout the community. I think some of our biggest things are a summer event that we have one of our healthcare interns put on, and that can be an event of their choice. And then in the fall, we have our free flu shot vaccination program where we go out into the community and meet people where they're at so they can make sure that we're vaccinating as many people as we can. And we provide a lot of things with our schools as well. So we do a lot of support for athletic teams. We provide some healthcare scholarships. We also go into the schools and put on scrubs camps and do a lot of things like that to make awareness to healthcare careers for high school students.
So I'm going to circle back to these sort of in order here. Letting an intern decide what to do seems like a potentially risky enterprise. What kind of things I do? What do you see?
Yeah, it's a tall order. So when I started taking over the summer healthcare internship program, which we get a grant from the Minnesota Hospital Association every summer to have that student come and work at the hospital, we thought it would be really fun to give them a little bit of a separate budget. So they have $1,000 and they can put on a community benefit project of their choice. So we teach them all about what community benefit means and the 990s and how we track those things. And then we kind of let them have free reign. And throughout the summer, we build time into their schedule so that they have specific days where they're working on their project. And we really encourage collaboration with other entities in the community to get their project done. And we've seen a lot of really incredible things. So we've had everything from free blood pressure tests at the local grocery stores to this summer, it was a huge the Ultimate Kids Adventure Night, sponsored by Ely-Bloomenson Community Hospital, where we promoted physical wellness, mental health for youth, and then also there was a little bit of a financial component to it where the kids could earn some EBCH bucks and then buy some things from the store at the end of the event. So it's kind of the sky's the limit. We let the kids be as creative as they want to be, and as long as they stay within their budget and get approval from me, but we have them put together a full plan and then execute it. And the kids get a lot of value out of it throughout the summer.
And what about the community? What's the response you see to these projects?
Great responses from the community. We have always had a really positive feedback. Last summer, our interns event was also youth focused, had over 70 kids attend. This year's event had nearly 60. It was just a beautiful night in the park. And I also just think it's really great exposure for EBCH in general and just that positive light in the community to show like, hey, we're out there, we're here for you. You know, there's more than just the sick care. Like, this is the well care that we give you as well.
Now, I recall you're talking as well about your professionals going out into the community, maybe nurses or other providers, vaccinations, things like that. Tell me a little bit more about that outreach.
Yeah, absolutely. So our free flu shot clinics, we have the big Ely Marathon and half marathon. So we set up our tent right in the park and give free vaccinations all afternoon and into the evening, and people love it. And so that's a great way to connect with the community and kind of show who we are and what we do. But we also have one of our nurses who's very passionate about getting out to the businesses. So we have the 2 business wellness days in the fall as well. And your business can just sign up and she'll come right to your doorstep and give vaccinations to all of your employees who maybe can't make it out because they work, hours that we offer the flu shots. So we want to make sure that everybody gets vaccinated, and that's a way that she can do that.
And are these adults or adults and children? Tell me a little bit about the nature of the vaccinations.
Yeah, vaccinations are a mix. So we actually do 2 days during parent-teacher conferences right at our school. So we hit a lot of the school-age children at that point in time and their parents and the teachers. And so we really try to make a wide variety of events and hit a wide variety of places where people are going to be gathering.
And you talked a little bit earlier as well about schools, about scrubs in the schools and workforce development programs, things like that. Tell me a little bit about what EBCH is doing in schools.
Yeah, the Scrubs Camp have really taken off in popularity. Before, we were just kind of helping with some of the Scrubs camps at neighboring communities. And then this summer was the first time that we put on our own Scrubs Camp at the school in the summer. And so we had the students come in, and I think there was 16 that participated this year, but they went basically department to department, and each of our departments had kind of a hands-on activity. So there was they brought the Lucas compressions machine in, and they learned some CPR. They learned what radiology does and nursing. There was a surgery component to it. They had the ambulance there so that they could go out to the ambulance and tour that and get a feel for what EMS does. And we just try to expose them to a wide variety of potential healthcare careers. And then I think we also do a really great job of showing them that with a 1 or 2 year certification, you could be out there working in a healthcare career, maybe without that 4-year college debt and things like that. So it's been very eye-opening for the students in our community, and we've gotten really positive feedback from parents, grandparents. We've had grandkids that were just visiting for the summer that attended, and people were just really appreciative of the opportunity to find out what those healthcare careers are.
So is this a day-long camp? Tell me a little bit about the logistics of it.
Yeah, this year it was a 1-day camp, and we do have ideas on how we could potentially expand that a little bit more, but we started it out right with a message from our CEO. So our CEO, Patty Banks, went, and it was held at our high school. So they used a commons area, and she went and spoke to the kids about, healthcare careers and the importance of what we do at EBCH, and kicked off the day that way. But we have lots of ideas for how we could improve in the future.
So tell me a little bit about community benefit in a small town like Ely. I can imagine that for a lot of residents, they experience the hospital in terms of illness or injury or some other kind of medical need. Why is it important to be out there in the community when people are not necessarily in that kind of need?
I think for us especially, it's really important for us to be out in the community, to be able to share our story and be able to just meet people and talk to people on kind of that boots on the ground approach, because we do have kind of a unique situation with a shared campus. So our hospital shares a campus with a clinic that is owned by a separate entity, and then also a long-term care center that is also owned by their own company. And so it's really important for us to share our story that we're an independent critical access hospital, and we're here to support the community in ways that they might not realize or think of. And just to be able to tell our story about what we do. And then I think that, there's lots of generations in our, I was born in the hospital, so there's generations of people, that have come to EBCH and still are kind of like, it's kind of like one of those things, like, until you need us, you don't really think about it, but I think by offering these community benefit things, it's just one more way that we can help showcase what we do, tell our story, and let the community know that we're there for them in many ways.
And do you feel that support coming back?
Yes, I definitely do. I think our patient satisfaction is very high. I monitor our patient satisfaction scores, and we get comments all the time about the impact that we've made on people's lives, and not just from, they had to come into the ED for something and that's how they got a survey, but, we do hear from them that the programs that we provide out in the community are very important, and they know what an impact it has for them.
Well, I hope you can keep those up for years to come.
Yeah, thank you.
Thank you.
Again, that's Jodi Martin, the Marketing and Communications Team Leader at Ely-Bloomenson Community Hospital. I'm Abby Mochtig, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.